could and it had resulted in a more close relationship all around the world about a single problem. It's so interesting that all around the world we are working on the same issue and with many similarities about challenges and also about the opportunities that we have. During the last 2 to 3 months, I was involved, first of all, in the process for handling the crisis on the side of care of COVID patients and also non-COVID-19 patients in one of the major hospital, namely the biggest hospital in Iran with more than 1,200 active beds. We admitted more than 1,800 patients and visited more than 18,000 patients during this period of time. And this led to a major change in all aspects of the clinical affairs of our hospital. And after a month, I was involved more deeply on the educational side of the crisis and how we could revitalize the whole process of education that face a deep and very influential challenges during the COVID-19 outbreak. In a simple way, I think that we could summarize the challenges in 3 phases and 3 areas. One of them was about and is about the personal challenges, the huge burden of psychosocial, not only workload, but also stress. And we found a lot of panic among the whole healthcare worker, and especially between our students and also interns and even residents. It's a major issue. And the second one in this area is about the differences in needs and also attitudes of our students and trainees regarding the pandemic or regarding an outbreak, a contagious outbreak that is much different from, example, a terroristic attack or war or airline crash. And therefore, because it is inherently more hazardous for people to be involved in the care of patients. And therefore, many students and even residents asked us about is there any guarantee to be safe when we visit the patient? The second one is about the education system challenges. Our system, as I know, all over the world has shut down in nearly 1 to 2 weeks because we closed the educational issues and wars in late February, and as I know, for example, the United States is closed on mid-March during 3 weeks, and most systems are not so ready to handle the whole process. How we could reallocate the resources, for example, from face-to-face learning to online learning or to e-learning, and what should we decide about different and a lot of issues that need to be decided based on uncertainties that is inherently in this pandemic. And finally, about the nature of the crisis, as I mentioned before. Therefore, on personal aspect, on education system aspect, and also on the nature of the disease and crisis, we face a lot of challenges.
Thank you. Let's come back to the Dr. Gorter. But stay at this topic as challenges. You will explain about the psychological problems commonly, especially students face during the beginning of the crisis, at the moment, and the future of the pandemic. Do you have any consideration, Dr. Gorter, when the students are coming back to the schools? Do you have any consideration, or do you have any plan in your school to arrange it well, psychological problems?
Thank you. I think this topic is very important to think about and to look for ways how to deal with this, because it is true what Dr. Mirzazadeh said, that there is a lot of stress, maybe seen and maybe unseen, among those who are about to treat patients. Students also have stress about how will my study develop? Will I have problems with continuation of my study? Will it cost a lot of money? So there are many uncertainties to deal with, and often the students are currently in a remote situation. They are not among their fellow students. They may be in faraway places, and they are well engaged in social media. That's a positive thing. So they are very trained in staying in touch, but still you have to deal with all these things alone. And for our regular services, we have student counselors, we have student advisors in our dental school, and also at university level, we have facilities for students who deal with difficult personal circumstances. So they get support, but the student now is not able to knock on the door of this counselor or this study advisor. So the threshold to look for contact, to search help, may be larger than we realize. And also some people, especially healthcare workers, often have the attitude that my own problems are nothing compared to the world problem. So why should I bother people who are already busy? And by doing so, they may neglect their own personal needs. And I think that as a dental school, every one of us, we should continue to make the students aware of these possibilities. There are professionals available to listen and to give wise advice for anyone who has concerns, whether it be about safety, personal safety, whether it be about educational progress, or feeling lonely and depressed. So for this, then the second point is these are the people who are hired to counsel. We as teachers, I think we as teachers may play a very important role. I don't know about your experience, but I have a lot of students who make individual tasks, and I am in touch with them online by email or other facilities, and they are very, very happy every time they get personal feedback on their study work. So they appreciate it a lot when they get response and feedback on the things that they are working on, because it helps them with the feeling that they are not alone. It helps them feeling that even when they are far away from the dental school and the physical community, they are still in touch with us teachers. And this is something that we really, as teachers, we stimulate each other to pay attention to this and to make work of it. So from the perspective of the students, I think these are very important aspects. And your question was also on when will the students return to the Amsterdam Dental School? We were closed mid-March a little bit later than the Iranian situation. As of today, the 11th of March, a little bit of our clinic is reopened. We had emergency treatments, of course. So 1 or 2 dentists were always available for emergency treatments, following a strict procedure in how to do this. And just as of today, we have opened a very limited access for patient treatment. But this is not for our students. This is only being done by our dental teachers and some of our specialist students. So they are already dentists, but they follow specialist training. And those who are in the last year of their specialist training are also given permittance to treat patients. And we start at a very low rate. And then hopefully we can build on this in the coming weeks and months.
Thank you for your explanation. Would you please let me know that it seems that you have provided psychological support, well-organized psychological support for your students. Is it provided for this crisis, for this pandemic, or you commonly, this kind of psychological supports commonly provided for all the students during the educational year?
At our university, we are part of 2 universities in Amsterdam. We are a combination. At the university level, for every student, regardless of which faculty or branch one is studying, we have professional counselors who can help students in need to seek the right help, to seek the right treatment, or maybe one needs to be referred to another professional. It can be of psychological needs, for instance, depression or other psychological problems. It can also be highly education affected students who are stuck in their studies and who cannot continue by themselves. They can learn strategies how to continue studying, and sometimes they can be part of study groups of other students, also from other faculties, to have weekly meetings, which helps them to progress in their study. So it makes them feel less alone in their struggle to continue. So this is a regular service. But of course, these days, we continue to make clear to our students that these facilities are open for their personal needs in these times of COVID-19.
Okay, thank you. Let's come back to Dr. Mirzazadeh. Dr. Mirzazadeh, you well mentioned to the system challenges when we have after COVID-19 pandemic. Let's move forward from the challenges to opportunities. How can a system provide an opportunity from such, I think, crisis happened, involve all the world, countries, universities? How can a government or a system can make such challenge to an opportunity?
Thank you so much for this interesting question. As you know, every change, first of all, every change needs a sense of urgency that convince the faculty members, the administrators, the students and trainees to accept the cost of the change, because the change is not costless, and therefore you should be convinced that the current situation is not acceptable and you should move to a new situation. And in many models for change management, the first issue is providing a sense of urgency for change. And now, during the COVID-19 outbreak, we have it without any effort. All the people around the medical school, around the university, understand that we need to change the current practice for educating our students, because we don't have any face-to-face interaction with many medical students during the last 3 months. The first option is to leaving them at home, and after coming back, we start the whole process. It's not just a matter of time, but losing the fitness of medical students as a medical student, as a learner, and also the major burden of loneliness is not a simple issue. And therefore, all the parties in medical school accepted that we should move forward to find solutions. And therefore, in regard to leadership of change, it's a very invaluable opportunity to convince many. I had a lot of times during the COVID-19 pandemic in a lot of webinars about reluctance of faculty members and even students to be engaged in e-learning issues. And many people talk about a rapid change in the mindset of faculty members. We talk about it, for example, for more than 10 or 20 years. But now we see many people started e-learning activities, yeah? And also about, for example, it's not a simple issue about hand hygiene. Hand hygiene for protection of patients is a great issue, and also protection of healthcare workers. And usually, I'm not sure why, but usually the faculty members and medical students are somewhat reluctant to obey the guidelines, and now they obey. And therefore, a great change in the healthcare system lead to a great change in education system. Inevitable. This is inevitable. And also, we are in a unique position to think about and to rethink about a more integrated approach to health professional education and healthcare system. For example, during the COVID-19, we could provide a lot of opportunities for learning about the importance of prevention, about the importance of leadership, about the importance of personal development factors such as resilience, hopefulness, dealing with anger, dealing with sadness, internal sadness, yes? And how you could provide hope, not only to you during tough time, but also to other people who are around you. We had a lot of opportunity to learn about system-based practice. You should follow the strict guidelines for professional protection equipment, yes? You don't have right to decide about why the best way to protect myself, yes? And also about the, for example, communication skills. It's not an easy task to communicate with a patient behind a goggle and shield and gun. Usually the patient couldn't see your face, couldn't see your mouth, and even might not be able to be familiar with the physician who is charging to care her or him. And therefore, we should find new communication skills to cope with the situation, and also about the professionalism. What's the role of physician to save themselves or to care their patients. It's not a simple issue, and many people during this period think about the balance between their right as a human being and their obligation as a physician. And therefore these are plenty of opportunities to learn more deeply about the core values of medical education and medicine for next generations, I think.
Thank you for your valuable notes. I think you mentioned a very important issue about e-learning. I know that our medical universities are moving from conventional education to electronic learning. Would you please let us know, Dr. Gorter, what is happening in European countries and other countries? Are you moving slowly or rapidly to a e-learning world, or something like us? We have challenges in in students atmosphere, and also faculty member atmosphere. We are not going to e-learning rapidly, but we are moving. I think we are changing slowly. What's happening in European countries, do you think?
That's very interesting to hear what Dr. Mirzazadeh said, because I recognize it fully. Everywhere, also at Amsterdam Dental School or other European schools, we as teachers, we are common to the way we have taught for the last years. And to change your way of teaching requires a lot of work, so a lot of time. So the tendency to, well, not to be too active in this is among many of us. And what I see now, driven by the terrible circumstances that we're in, is an enormous speed in development by colleagues, by myself also, also colleagues, to change their regular teaching into a digital one, into e-learning. And it is quite a lot of work, but it's also very rewarding, because by doing this, we know that we can reach our students better, maybe better than we have ever done before. And also, it is very much in line with recent theories on teaching. So the situation in which students enter a lecture hall being unprepared and then listen to the professor speaking about an interesting topic and then go home is a very passive one. And already we are working on ways of what we call blended learning, in mixing methods, in finding ways to have our students study some aspects of what is going to be taught in the lecture, to study beforehand. And we as a teacher do not talk for an hour and spread news that the students can also read in a book. So instead of that, we could use this hour of contact with the teacher to have the students prepare questions and to have the teacher go more deeply into certain aspects. And in this way, there is a more interactive way of learning. And as far as I know, that the best way of learning is to work with the topics that you are studying. So if you listen to it passively, or if you just read it, the retention time is very much less than when you have worked, discussed it, thought about it, formulated a question, etc. So this current process of increasing e-learning, I hope personally that we all as teachers will continue doing this, also in times when it is more allowed to enter the dental school. And in whatever, and it may be necessary too, because when we think of having our regular programs, we should realize that it might not be in the same circumstances as we have done this through the years. We may have to limit our physical contacts with the students anyway, in order to well, to deal with the social distance restrictions, etc. So that's a good way of thinking about that, and it certainly is a challenge. And I think Dr. Mirzazadeh beautifully explained how the current situation can also be a very good start looking forward.
Okay,
Yes,
yes,
sorry.
please.
During your talk, I think about, I reviewed the history, not just as a political side, and I don't like to talk about the colonial era, but as you know, after World War II, the world has changed forever. Before that, many countries, for example, in Africa, in Asia, was colonial to, for example, British Empire or other countries. I'm not talking on political issues. But after that, many countries ask for independence. The India, Indonesia, in the China peninsula, yes, in Middle East, many countries in Africa during 1948, 47, 1950, yes, because many people fought against Nazi regime during 1939 to 1945. After that, they asked the governments why we should be a colony of other country, because we fought the Nazi regime shoulder to shoulder, and we like to have the equal right to other people. The same situation I believe occur after Corona pandemic. Medical students for a long time ask us to change the situation, yes, ask us to be more active in the classroom. And we were reluctant. And we believe that they should sit and hear directly, face to face, to our talking and to our lecture, to learn many issues. And now we accepted that learning could occur without any direct face-to-face interaction. Why we should convince them after the epidemic they should sit all the time and hear to our non-interactive lectures. And I believe that if we use this situation rationally, with caution, we could change the health profession education much more rapidly than we believe we could do in next decades.
Thank you for your explanation. Let's back to Dr. Gorter. Dr. Mirzazadeh well explained about hope in students and also faculty members. How do you think we can motivate and provide a hopeful future for the students? You know, they have many concerns about their future job. They have concern about their future education. They're moving from a traditional education to a new world of education. I think they are very concerned about although because they will become a member of a healthcare system, they have concerns about their health. When they are visiting their patients, they are in communication with the personnel in medical centers. How we can provide a hopeful future for the students?
I think when confronted with serious problems, be it a disaster or be it a situation as we are dealing with now, our brains work in several ways. We tend to look at things in an analytical way, and we as scientists, we always want to know what do we need to know on a rational level. That's one thing that we need to pay attention to. Also, when it comes to safety and concerns of the students, there's also a second way our brains work, and that's in a practical way. So we always want to know immediately, what can we do? How can we change the situation? And possibly dentists are even more practical than many other people, I think. But there's also a relational way of, in the way our brains work. And we need to pay attention to how we feel under the situation as teachers, as students, and also how our patients might feel. And bringing this all together, that's the unique possibility of the human brain, that we can integrate all of these aspects. So when we talk about giving hope for our students, we need to deal with this from both analytical, practical, and emotional perspective. And we should not talk for our students. They know a lot themselves. They can express their needs, they can express their concerns, but also they go through experience, like we all do. Just last week, my colleague dentists who work in their own dental practice outside of the university, they were allowed to start treating patients, in regular dental practices. And they learned a lot from this first week. And they were also concerned about what will happen. Will I get contaminated? Will the patients be too afraid to be treated? And of course, using protocols and being very careful in everything, they build up experience. My message to the students would be that there is no certainty that one will never get contaminated, not from this virus or from any other thing that you cannot predict. So we always live in a dangerous world, and we need to know how to act carefully, but we can never exclude risks. So what we have to do is build up experience in how to deal with the current situation. And as a dental school, I would say we need to help the students experience this and build up hope, build up trust that they can be safe caregivers. So whenever the local authorities, because they are leading in this, whenever local authorities are giving permission to enter to dental school, I think it is very wise to build in this possibility and to help the students experience how to deal with this situation. And that will give them hope that also in the future, given other situations that we cannot think of today, they will be capable of being careful caregivers.
Thank you very much.
Pouyan, may I have a sentence about this issue?
Yes, please.
The most important issue that I think is maintenance of hope among ourselves and among our students. First of all, we should emphasize that this is not the first pandemic around the world. at least nearly 100 years ago, we have Spanish flu pandemic. It's not a simple task for whole the world to tackle with this pandemic. More than 2 years and a lot of fatalities. And also about, and even during the uh, medieval, we have black plague over the Europe and many other countries. And the human being pursued their life during all the challenges. You know that during the last decades, not only from the wars, but also from car accidents, many more people has died rather than from COVID-19 pandemic. Therefore, it's inherent to the life of the human being to be faced by challenges and to find solutions to them. And also, it is inherent in the nature, as Professor Gorter talked about it, it is inherent in the nature of our profession to be faced by hazards that directly could influence ourselves. It's only our patients, yes, and therefore we should accept it. It's not means that that we shouldn't provide enough protection for ourselves or for our students. Not only on the human side that we are human, and as human have right to has protection. As healthcare worker, we should be healthy, and we should provide care. Rather, we lost a lot of healthcare workers, and the healthcare system collapsed. And therefore, on the systemic perspective and also on human perspective, we need and we should provide enough protection for our medical students or residents. It doesn't mean that we could provide guarantee that they will be safe. And therefore, this is the reason that I believe that we don't need to talk about education after COVID-19. Instead of it, we should talk about education with COVID-19. Postponing the coming back. I reviewed the questions and comments in the chat box, and many people, the chancellor of one university in Afghanistan and also in other areas, are so concerned about the distance learning, and is it really could replace the hands-on learning from patient? Surely not. We need to have our students in hospital, in dental clinics, yes, to be involved with patient and learn from patient and learn about patient. We need it. And if we talk about the revitalizing education during pandemic by, for example, some sort of e-learning, doesn't mean that we believe that it could replace the face-to-face learning. It's the last resort that we have during this time to maintain the quality of education. And we should plan for the earliest time that we could come back our students to medical schools, to dental schools. And we need to convince them that please don't wait to the last COVID virus leaving Iran to come back to the hospital. You could not imagine when it happens. Yes, and therefore I greatly appreciate and acknowledge the comments that we need face-to-face learning in hospital setting. As I talk about the importance of e-learning, I truly aware about the risk of replacing real learning from patient with virtual learning. It could not be replaced. It just could be complemented. It just could be fortified, and now could be as the last resort. And I think that, for example, we are working to have our students as soon as possible come back to the hospital. But at the same time, we provided, this is the question area 4 that you asked us about, any novel approaches that we could provide it during that period. But we had provided a 4-week online courses, clerical rotation in the Department of Internal Medicine in IKHC. And usually each day they have more than 4 hours interactive teaching and learning sessions. We have virtual rounds that they see the patients, if the patient had permission to be recorded and to be video clipped. And after that, the whole process of clinical reasoning. But I'm sure that it could not replace medical students to be involved directly with the patient. Yes, and I think that we should do both of them. Not only distance learning, but also distance learning and online learning could save the values that we are losing during the pandemic.
If I may add to that, I fully agree with this. And it, when we talk about distance learning, it is basically theoretical learning, and the practical skills that every student needs to train should be maintained. So that's a difficult situation. One of the possibilities that I hope will develop much further from where it is now are the possibilities of virtual reality training. As in medicine, many surgeons, they train their skills in virtual reality environments, which approaches the real situation very closely. And it gives them the possibility to train. Like a piano player, a piano player needs to practice the fingers every day, otherwise they will get stiff. So in parallel with that, also for dental students, possibilities for basic manual skills training in a virtual environment, they are already existing, but they need to be developed further and further and made possible for dental schools around the world. And that would also be a big step forward, apart from the real patient treatment, of course, in preparation of that.
Yes, you mean that the online learning, teaching and learning should be confined to theoretical courses, and it is necessary to prepare our students to live with COVID-19 in practical courses. Do you mean?
Not the distinction is not that clear. Like Dr. Mirzazadeh showed or explained, when 1 or 2 students have an actual patient encounter, and this meeting is being transferred in a e-learning situation, other students may learn from this as well. So that's a combination of e-learning and practical. So they can learn from the experience of their fellow students in a much broader way than we do these days.
Pouyan, sorry. I feel that we are somewhat late, and some questions and some comments from the participants is necessary to be covered. But I like to emphasize on the importance that online learning, e-learning, face-to-face learning, practical learning, all of them are tools for learning. And therefore, we should find the goals and objectives, the competency that we should cover during the educational period. And then we should thoughtfully think about the possibility of covering of that goals or competencies. If it's possible to be covered by online learning, e-learning is good. And if it not could be covered, we shouldn't consider online learning as a panacea. It's not really work, and it's so dangerous because I think a major challenge for us to be manipulated by e-learning. We should manage. We should manage the e-learning, and e-learning should not manage us. And this sort of thinking is a major issue now for me, because, for example, you could have just today we have a 2-hour session for case-based discussion based on real patient in 8 small group, each 10 students, and with a moderator from senior students, step by step talk about and discuss about the differential diagnosis, about the exams that they should do, about the prognosis, other issues. Yes, it could be covered. But for example, for suturing, it's much more difficult. And finally, we need real work to become a real practitioner.
You mean that you recommend a combination of the e-learning and practical learning, but it should be smartly selected. In some cases, you recommend that e-learning can cover all of the issues, but in the other cases, it is necessary to involve students in practical courses. Thank you. Excuse me. How do you think about the assessment of the students? Do you know if there is challenges about how we can assess our students promptly? They will become clinicians, they will become dentists in dental schools, and how we can assess them perfectly in this e-learning, especially e-learning. There are some faculty members, don't believe in e-learning because you cannot assess the students perfectly. What do you think about it? How we can assess them quite perfectly?
We do have experience with assessments and examination online, and the local university in Amsterdam, Free University, has built up experience in this during recent years, and it used to be among smaller groups of students, and it's called a way of proctoring. It's so the environment where the students goes for the assessments needs to be shown on camera, and while the students does the exam, there is no other internet facility available, and they are being monitored by video. So they need to make this video connection available, and then they can do their exam. And recently, also at our dental school, we have done this for larger groups, even groups up to 100 students at the same time. So they get the same examination, theoretical examination, at the same time in a very secure and valid way. Of course, when it comes to other aspects of dentistry, when it comes to manual skills, when it comes to being examined in all the competences that are required in the clinical situation, this, I cannot imagine how this can be done in the near future. Maybe mankind will be very inventive, and there will be possibilities sooner than we can imagine at this moment, probably. But at this moment, I think that the full competencies of the dental students also require a face-to-face clinical examination situation.
Thank
But
you.
you never know. You never know. There are countries. It's not in Holland the same, where dental examinations or the dental education is finished, and after that, the new dentist is required to be in a dental practice for 1 or 2 years before he or she is allowed to practice independently. So in this could also be a way that dental schools go forward.
Sorry, for the sake of time, I like to provide framework for challenges of assessment. Some of the challenges are technical and some of them are conceptual. For example, as Professor Gorter talked about proctored exams, in many schools, there isn't any previous experiences with proctored online examination, yes? And therefore, this is a technical challenge. We could provide soft ways, artificial intelligence could help us providing, and also there are different level of proctoring for middle stake, low stake, and high stake examinations. And we could start with low stake and middle stake examinations just before talking about high stake examination, for example, medical school entrance examination or license examination. But as our colleagues talked about it in their in chat box, there are conceptual challenges because usually it is not possible to assess, for example, technical skills by, for example, online learning. But as Dr. Gorter talked about the invention and innovation that humankind have, it's not possible, at least in mid-term or long-term, to provide some. For example, as you know, I'm sure that for a long time, the only mannequin or moulage for teaching dental students about dental extraction or, for example, denture was a real patient jaw and denture. After that, we come to some sort of low fidelity moulage, yes, with cast. And now, as I know, in dentistry, we are talking about haptics without any real material outside. You could provide the real experiences of working with the denture to fit it in the patient situation. And therefore, we should consider that. But in practice, it's not so easy to implement such issues. I think that we talk about the importance of goals for providing teaching methods. And I think the same for providing assessment methods. For example, we should think about the competency of a physician. Yes, we have some competency in area of patient management, providing plan for patient. Yes, about communication skills, how to communicate with patient and families and other colleagues, about history taking, many of these, and also about clinical reasoning. Yes, most of these items could be covered by online assessment. Not so easily, not completely, but could be covered. And also we have some areas, for example, performing physical examination. I'm agree with my colleagues about procedural skills. It's not so simple to do that. Yes, but I think that we should do our best to cover all the areas that we could and we should cover during the pandemic. We are responsible to do that. And then we should think about how we could bring our students back to medical school or dental school. And also we should think about the innovative models for finding solutions. For example, we think about, currently we have interns in our ward. We think that we could provide an intern for 1 to 2 medical clerks that are in distance, yes? And in a team, they could take a history from a patient, for example, via a camera or even via a smartphone. But for physical examination is not same, and we should think away. Therefore, thinking that we need to be back to do our education efforts is not a real paradigm. We should shift from it to we should do our best, and also we should ask our students to come back as soon as possible.
Thank you very much. About assessment, if I'm true, would you please let me know if I am true that you mean that assessment should be designed based on the goal of the education, and it
And
is
competence.
and you expect your students after graduation.
Yes.
Yes. You know, we have less than 5 minutes. We tried to cover all the questions mentioned in text box, but because of lack of time, let's back to Dr. Gorter for a conclusion.
Pouyan, sorry.
Yes.
A gentleman, as the Chancellor of Medical University in Afghanistan,
Yes.
asked us about the challenge that they face in their university or medical school, that usually online courses lack interactivity.
Yes.
Usually, the worst scenario from the non-interactive sessions in face-to-face occur during online learning or e-learning, yes? Just providing some material for medical students to read alone. And this is not a good choice for them, because they need some sort of mentoring, some sort of supervision. And I think that a major issue for most of us, that we think that e-learning could solve our problem. It's not true. E-learning is a tool. And therefore, I like to emphasize on the importance of instructional design and good planning. Before this webinar, I worked on my presentation that I should, and my workshop that I should provide tomorrow for more than 100 faculty members via online method. And usually we think that it's not possible to have small groups or interactivity via online, because we should provide lecture and they should hear and nothing else. But interestingly, I provided some video clips from my presentation 2 days ago, and I will start my workshop just with small group working in 8 small groups. And in turn around, each faculty member or each participant should do hands-on experiences with this online software. Yes. And after that, I will provide a few minutes lecture about the interactive methods in lecture. And then they should go to another small group and to think about in group thinking and come back and provide feedback. Therefore, I think that if we could provide good instructional design for any session, we could have a very, very good experiences for our students. But if we think that just thinking about e-learning and having a software solve all the problem, nothing, nothing. So messy.
Mhm. Okay, thank you, Dr. Gorter. Gorter, would you give us a conclusion about this webinar? I read, you know, the you last year after visiting our school, an important paragraph you mentioned that we appreciate a school of dentistry because of clinical practice. And all of our faculty members and students are worried about the future of this practical practice. Do you give us a conclusion about the webinar? Should be hopeful about the future, or we are supposed to plan and think about it and negotiate with each other and negotiate with experts like you, like Dr. Mirzazadeh, to arrange a plan for the future.
Yeah, thank you. Um, the example by Dr. Mirzazadeh just before this was a very good example of how e-learning can be interactive, and it can be used it's a brilliant example that can illustrate that it is active learning that you're promoting in this way. And active learning, like I said before, by active learning, a student remembers all the content in the best way. Now, to summarize this, I would say that before everything, safety is paramount. Everybody needs to follow directions because of personal safety of the student, of the staff, and of the patient. That's step one. And communication, it was already mentioned, communication and transparency about why and how certain decisions are made is also very important. Any decision needs an explanation, and that will help people understand and also be aware of why things are happening. Secondly, so safety first. Secondly, flexibility. We are in a situation that is developing. Nobody of us knows how the situation in 1 month's time will be like. We all hope for the best, but things may go in a strange way. So flexibility is needed from the students, is needed from the staff, and certainly we ask flexibility from our patients. So we have to deal with this, and we are all aware that we are joining forces in order to make steps forward. And thirdly, technology can help, but we have to be realistic. As it comes to clinical situations and in a learning situation, we are currently not so far that we can simulate every clinical situation in order to assess our students whether they are competent to be allowed to treat a patient independently. We will need to make steps in this. But there is hope, and I am convinced that the current situation will have a very, very positive influence on development of second best learning situations that will prepare the students very good for a situation in which they can show their competencies at full. Also, we mentioned the importance that to pay attention to the psychological aspects of this situation. Not only the psychological needs when it comes to personal well-being, which is very important, people being very remote from each other, but teachers and students need to adapt to new situations. This also requires psychological elasticity to get used to things. We cannot require from all of our colleagues that they adapt the same things at the same time. People have different speeds of adapting to things, and we all need to be aware of that. And then further, when we look around, I just mentioned that we had a survey from the Association of Dental Education in Europe. The survey will be published in the next issue of the European Journal of Dental Education. But if you look at the website of the ADE, ade.org, you will find a lot of information coming from all corners of the world that are on dental education. So sharing our experiences, the wisdom that we gather together will help us also forward. So I would really recommend those who are interested to visit the website of ADE and take a look at all this. And every day there is new stuff there because the developments are going on. So we learn from each other also.
Okay, thank you very much. Dr. Mirzazadeh, as conclusion, I know you have been in charge of training faculty members for several years in the Tehran University of Medical Sciences, and also you have been in charge of education development in Ministry of Health. What's your conclusion about the future of the education after? And I know you don't like after COVID-19, you like with COVID-19 education. What do you anticipate about the future of the education in this era?
Thank you, Pouyan. Because the sake of time, just a few sentences. First of all, I like to emphasize on the important issues and topics that Dr. Gorter talked about, the principles, the importance of patient care, the importance of healthcare workers' safety, and the importance of resilience and adaptive mindset, how we could cope with the challenges that we face. And this is a role modeling of us for our medical students. It's so important. If they see that we wait and watch the COVID-19 go, and then we come to the medical school, they learn this is the mode for reaction to any challenges that they will face during their lifetime, personal and also professional. But just 2 points. First, about the importance of educational management, about the importance of planning and providing resources and thoughtful implementation, and then evaluation and monitoring, evaluation and reflection. And the cycle of educational management is so important. And also about the importance of educational leadership. Leadership is so important. We talk, Dr. Gorter, talk about the communication. It's a very important issue because usually our plan failed not because they are wrong, but because many people don't understand it, and therefore they don't because they have not been convinced. Yes, and therefore they has resistance against this ideas and innovations, and therefore education and management and education leadership is 2 important issues that will help us to cope with this COVID-19 pandemic and learn a lot from it for our future life in academies.
Thank you very much, both professors. I would like to express my sincere appreciation to Professor Dr. Ronald Gorter from ACTA University, the Netherlands. And also I would like to express my appreciation again to Dr. Azim Mirzazadeh from Tehran University of Medical Sciences. And also I would like to thank all of the audience in this webinar, and also technical support from international affairs and Global Strategies Office of Tehran University of Medical Sciences. Thank you very much for your attention and have a nice day. Thank you very much.
Thank you very much and bye.
Bye.
Take care and stay healthy.
Thank you.